Arteriovenous anastomosis, open, by upper arm cephalic vein transposition. Arteriovenous connection is made in the upper arm by anastomosing the cephalic vein to the brachial artery. Arteriovenous anastomosis, open, by upper arm basilic vein transposition. The surgeon dissects down to the basilic vein on the medial side of the upper arm and mobilizes the vein. A subcutaneous tunnel on the anterior side of the arm is created, and the mobilized basilic vein is transposed to this tunnel and anastomosed to the brachial artery. Arteriovenous anastomosis, open, by forearm vein transposition. The physician dissects down to the vein and artery. The subfascial plane is identified and elevated laterally to the flexor carpi radialis, FCR, and medially to the brachioradialis, BR. The plane between the BR and FCR is dissected and the perforating vessels are identified and cauterized. The pedicle is followed to the antecubital fossa. The tourniquet is released, and the vessels are further cleaned of their adventitia under loop visualization. Using microvascular techniques, a suture for the arterial anastomosis is performed and closure is completed. Suction drains are placed in the neck. If a Doppler is to be used for postoperative assessment, a suture is placed to mark the pedicle site. A splint is fabricated and secured to the arm with an elastic bandage. Arteriovenous anastomosis, open, direct, any site, e.g. seminotype. Through an incision in the non-dominant wrist or antecubital fossa, the physician isolates a desired section of artery and neighboring vein. Vessel clamps are placed on the vein and adjacent artery. The vein is dissected free, divided, and the downstream portion of the vein is sutured to an opening created in the adjacent artery, usually in an end-to-side fashion, allowing blood to flow both down the artery and into the vein. Large branches of the vein may be tied off to cause flow down a single vein. The skin incision is repaired with a layered closure. This arteriovenous anastomosis will allow an increased blood flow through the vein, usually for hemodialysis.